Yesterday, I did a video about one of Danielle's comments where Danielle said, I don't want universal health care. My apologies. My brain glitched for a minute. And I did a video asking her why. And she replied here with, universal health care gets its money from government taxes. So that's why we already pay a lot in taxes. It's not healthcare will ever be free. I think she's trying to say healthcare will never be free. Just like I would always choose PPO over HMO, okay, so forth, so on. You don't like the fact that it comes from taxes. But I addressed that in the video. So let's address it again. You say we already pay too much in taxes. Fair enough. Fair enough. But do you understand that you would be paying less overall for your health care if we went to a universal healthcare system? Like I laid out in the video that you're replying to here, if we were to take a UK style system, for example, you would have about 10% of your pay, your gross pay, taxed before any money is coming out. And in exchange for that, you would not have to have deducted from your paycheck any deductions for Medicare or Medicaid. You would not have to pay for your health insurance premiums. All of your out-of-pocket expenses to go see a doctor, to go to a hospital, to take an ambulance ride, all of that would be included. You would eliminate all of the Social Security withdrawals from your paycheck, because if we adopted a UK system, we would also get a national pension with that, which is what they get in the UK. And you would end up paying less for your care. And what I don't understand about the position that you're taking here, and I'm being very serious when I say this, I don't understand why you're willing to continue to give thousands of dollars to a private health insurance company where some CEO is going to make a shit ton of money off of your illness, your death, your this, your that, instead of having your own tax dollars work for you. I mean, do you not want your tax dollars to pave your roads? To pay for your schools, to pay for your park district, to pay for your libraries, to pay for your junior colleges, to pay for your police and fire protection? That's your tax dollars at work. Why wouldn't you want your tax dollars to work for you to benefit you from a healthcare standpoint instead of making some fucking CEO millions of dollars every year in bonuses? Now, you also go on, and other people go on to talk about wait times and whatnot, what have you. I believe that we could do it better than other industrialized nations. I believe that we could figure out how to get those wait times down. And don't forget that some of these countries that have these universal healthcare systems, people from this country go to them to get healthcare because it's too fucking expensive here. I was doing videos last year or the year before about a conservative woman, a MAGA supporter in Texas, who goes to Mexico to get her dental work done because it's too much money in taxes, but she can get it done infinitely cheaper in Mexico. Or people that live along the northern border that try to go into Canada to get health care, or try to at least go into Canada to get their prescription drug medication taken care of. See, the problem that I think we have is that here in the United States of America, we have the best doctors. We have the best doctors, but we have the most fucked up healthcare delivery system. We have a system in which folks like yourself are advocating to continue to pay millionaires and billionaires thousands of dollars so that they can profit off of your healthcare, instead of eliminating all of that and getting down to brass tacks and saying, hey, I want my tax dollars to go to work for me, my family, and my community. And you did say, you went on to talk about how great your doctors are and how they saved your life, because I pointed out that you're a breast cancer survivor. Why don't you want that for more people? People who can't afford health insurance because health insurance is expensive. People who can't afford to go see a doctor and might otherwise go untreated for breast cancer. Why wouldn't you want that for other people? Why do you want people to continue to go broke trying to get the care they want? You have great insurance. That's awesome. So do we. We pay through the nose for it. We pay $1,800 a month for our insurance. And that's just to have the goddamn insurance because we're self-employed. Why wouldn't you want a system where you're paying less, other people are paying less, because you might have to wait a little bit longer? That's the whole reason? Or it's because of your tax dollars might go to help somebody else? Is that what it is? I'm sorry, your position, in my opinion, is the wrong position. You want to continue to make healthcare CEOs extraordinarily rich while waiting for them to deny a claim for us, waiting for them to say, no, that's not good. You can't have that, even though you've been paying into it. Yeah, you got lucky. You have great insurance. That's awesome. What about the next one? Do you not give a shit about the next one?